Santos, and welcome to Your Health Today. My guest today is the very famous Dr. David Pelaia, who is a plastic surgeon here in the Westchester and New York area, correct?
That's right.
I'm very happy to have him as a guest. He's here to talk about some of the things that he does, not all of it, because that will probably entail maybe 4 or 5 shows. So David, thank you. Thank you for being a guest. And
thank you for inviting me, Minnie.
now, how long actually have you been doing plastics?
I've been in practice for almost 20 years. I came in 1991. Did my residency in general and plastic surgery at Montefiore in the Bronx. And then I came up here to Westchester County.
Right now, I know that you're great at doing breast. That sounds kind of funny, but
thank you.
I've had a lot of patients who've had breast reductions, augmentations, and reconstruction for breast cancer. You also have a real expertise in facelifts. Tell me a little bit about that, because whenever I think of facelifts, I'm always thinking of Joan Rivers, right. And I actually got to see her one time, and it's not a pretty sight.
Well, I love to do plastic and reconstructive surgery. I love to make people happy and help them in any way that I can. I think that the breast reconstruction aspect of plastic surgery is the part that really keeps my soul pure, because it's very altruistic, and frankly, it's not very lucrative. But the facelifting practice is my sculpting, and I'm able to transform people. I'm able to rejuvenate people. I'm able to do things that really impact their lives in a terrific way. And many people think that plastic surgery is frivolous in a certain sense, or vain in a certain sense, but we've learned much of the reconstructive techniques and aesthetic techniques balance each other. They play into one another. You can't do an excellent facial reconstruction without knowing the facial anatomy, and you can't do a facelift without knowing the safe planes of dissection and the safe way to do it. I think that breast reconstruction and facelifting have both evolved over the last 20 years in a very significant way. We tend to go toward more minimally invasive ways in some circumstances. And some things are tried and true, although there are so many things that are new and innovative, we still fall back many times to the things that we have come to rely on as our gold standard. One of the more important contributions has been autologous. Autologous meaning from your own body. Fat transfers. So we take fat from the tummy or some other unwanted place, and we can either put that in the breast or we can put that in the face. And a lot of people are using fillers and that kind of thing for facial augmentation to remove nasolabial fold lines, improve malar prominence. And I think that the fat is a more permanent way of doing that. Sometimes it needs to be repeated, but it's a more permanent way of eliminating those problems. And that has impacted the facelift practice a lot, because I almost don't do a facelift anymore that doesn't involve some kind of autologous fat transfer. I usually place some in the nasolabial fold, a little bit in here, sometimes in the pre-jowl, and certainly in the malar area. So the fat is also utilized for the breast reconstruction. And at the Institute at Northern Westchester Hospital, we do a lot of breast reconstruction there. We've become sort of a magnet for Westchester County and even New York.
Oh yeah, first of all, their cancer center is amazing. I mean, it's really, really amazing. And then it's such a team. I pretty much send all my breast patients there because not only the care that they get, but you guys make them feel good, which is really hard because, you know, the breast cancer patients are undergoing a really difficult time, but every person that they meet there is so empowering and makes them feel good. And when they finish, you know, they're happy to show their reconstructions, right. which is a good thing, because it's no longer like a thing that I don't want to show and it's a shameful thing. It's a thing that look at what Dr. Pelaia did, which is good.
It's nice to be able to take someone who's going through a very difficult time and needs guidance and is, a deer in the headlights, basically.
Right.
And you take them along, introduce them to a concierge who takes them through the process. They're greeted by nurses who are very empathic and sympathetic. And then they like to have their hand held while they go to sleep. It's a very warm environment. Everybody is in tune to the aesthetic aspect of it, not just the cancer aspect of it. And many times people look better when they're finished with their cancer treatment than they did before they started, because we have these innovative breast lift, breast reduction, incorporating that with the lumpectomy or partial mastectomy. We've begun to use intraoperative radiation therapy so that the patients don't necessarily have to go through a long radiation process afterwards.
Right.
So we have so many new innovations. It's a wonderful place to work.
Now, tell me some more about the facelifts. Now, I just wanted to ask you a question about putting the fat in the nasolabial folds. That must feel a little bit more natural than using like the Juvederm, which is a little bit harder under the skin.
There are a lot of different things that you can put in your face that will give you augmentation. People sometimes are confused between augmentation and muscle partial paralysis, which is the botulinum products. Fillers are used to improve areas where there's either been fat loss or atrophy, or areas where the muscles of facial expression have caused the tissues to create folds or lines. So fillers can be permanent or temporary. They can be grafts or autologous tissue. In a way, using temporary fillers is good, because if you don't like it, it's only going to be there for 6 months to a year. If you do like it, it has to be repeated, and you may not like it the second time as much as you did the first time. There's also the issue of cost. There's an issue of bruising and downtime, and there's a pain aspect to it as well. So sometimes doing autologous tissue transfers is going to be a better option for some people, both on their downtime and on their wallet.
Right.
I like to use a combination of both. I do autologous fat grafts in the office under local anesthesia. A lot of my facelifts I'll do in the office under local anesthesia as well. I think that the environment is heading in that direction, less invasive and less downtime, and economically less. I think the economy is obviously a big influence these days. People are doing things that you wouldn't expect them to do, going to doctors that they've never met to have a facelift, and just because they'll save a couple of $1,000s, I think that's
not a good thing. I had one patient who went to South America to get he had, I guess, bags under his eyes, and went to South America against my advice to have it done, and when he came back, his eyelids were exposed. So he was walking around with pretty much this look, and ended up then spending a lot more money going to someone to fix it.
right.
And I've had people who go and have bad outcomes when they try to cut corners with saving money, because I had one patient who went to get her eyes done also, and the doctor told her, this is some person down in the city, if she paid in cash, he would half the cost. Right. And when she got an infection, and I never forget, because she had the surgery on a Friday, got an infection, called me on a Sunday, he wouldn't take her calls. So I had to meet her in the office on a Sunday. She had pus coming out of her wounds. It was pretty gross, but right. You kind of get what you pay for.
Right. So the cost of going to a facility that is like our, we moved our office from a chic Adobe building, boutique office with an operating room into the hospital because it's a safer place to do surgery. We have everything that we need there in case a bad outcome occurs.
Right. And you have to keep that in mind. Let's think about Kanye West.
So the cost of all of that has to be translated into a higher cost because the quality is better.
Right.
All right, so it's worth it to pay a little bit more to get the best, I think.
Definitely, and to have the backup, because you never know. Like I said, with Kanye West's mom, you know, you never know when something is going to happen that you need the backup that you may not be able to get in one of these AM surge places.
Right.
Now, what do you think about those, what do they call them, lunchtime facials or lunchtime facelifts?
I think that a lunchtime facelift is a misnomer. I don't think there's such a thing as a lunchtime facelift. Unless you're talking about fillers, and even that, you may end up swollen and bruised, and women are not likely to go back to work when they're swollen and bruised and red. It just doesn't work for them. So it can be done it can be done in a half hour, it can be done in 15 minutes, you know, depending on what you're having. You might not necessarily want to go back to work after that. And even a facelift, you can do a facelift on a Friday and be back to work on Monday. You'd probably be a little bit bruised, a little bit swollen, but a lot of that can be concealed. Back to exercise is a different story. That's about 3 weeks. But you should realize that any time you have an injection or a procedure done where there's cutting involved, there's always a chance for bleeding or infection. Right. So even though you can call it a lunchtime procedure, it may not necessarily be that for you. And I try to let my patients know that the recovery is not as quick as you might expect from what you read
right.
or what you look at, especially with these reality television shows. They make it look like everybody's back to normal in a half hour, and that's really not true. So I think those shows have brought a lot of attention to plastic surgery, and I think they've been good for plastic surgery. But I think that the lifestyle that we lead and the things that we can and cannot accomplish are a little bit exaggerated.
Right. I think
So,
most of us, you know, we're all baby boomers are hitting the age at the same time and want to maintain a youthful look, but I think a lot of people just don't want to look as tired. Right. I mean, the first time I went to get Botox with you, yes, I've got Botox with Dr. Pelaia. You know, it was just that I do this all the time because I'm always like paying attention to patients, and then one day I'm driving and I look in the side view mirror and things look bigger than they are. Right. And all of a sudden it looked as if I had like these huge craters here, and right. Just not wanting to look as tired, mm-hmm. which is what I think most people, most men and women, are looking for.
Absolutely. And you mentioned something else. You said youthful. I think that cosmetic surgery is intended to make you look more youthful, but it's also intended to make you look more natural. So we want to avoid that kind of pulled look, that obvious, oh, where did you have your facelift? I like to think that most of the facelift patients that I've taken care of are walking around and no one even knows that they've had anything
right.
done.
They think they were on vacation. You
on
look
vacation,
really good.
you look rested. What did you do? Yeah, but not who did your facelift. I mean, you don't want to hear that. Eyelid surgery, you can have a beautiful eyelid surgery and still look like you've had something done. Maybe not the first year or the second year,